Hello everyone, welcome back to my channel again today. My name is Chioma Leo and I'll be discussing alcoholism today or alcohol addiction. You know, we are living in a world today where people have normalized the intake of alcohol. Yes, and sometimes your friends or your family could tell you that if you don't take alcohol, that means you are missing out, a big deal, you know. So alcohol has been so rampant. In fact, it's everywhere, it's all over. And some people, because of what they see the some of these alcohol companies write on their drinks, drink responsibly. You know, when they see, they feel nothing is there. Like I can just be taking alcohol. Is a part of life. There is a kind of elation or effect or feeling of pleasure you get when you take alcohol, and that makes it very addictive. You start taking it from small, maybe from a glass of alcohol to one bottle, from one bottle to two bottles, from two bottles to three bottles, and so on and so forth. And there it continues. Now, alcoholism is a chronic condition. It's a very terrible condition that is characterized by a person's inability to control his or her alcohol consumption despite its negative effects or consequences. Now, there are so many causes or risk factors of alcoholism. It could be genetic components or family history. There are some families that are well known for alcohol consumption. You check the mother, the father, the children, everyone is taking alcohol. It could be genetic, it could be a genetic component or a family history. Then sometimes it could also be social factors, external factors, social or your cultural factors and all that. Maybe friends from peers and all that. Some of your friends will tell you, why are you taking non-alcoholic, a man like you and, a big woman like you? Why would you be taking a non-alcoholic drink? All these kind of pressures from friends, from social hangouts and all that could make somebody to start taking alcohol. Then another thing is mental health conditions like depression, anxiety could make somebody to go into alcoholism. Some people who might have gone through some trauma, maybe from rape, maybe their partner cheated on them or left them for another person, heartbreaks and all that. It could make somebody to go into alcohol consumption. And this is how it starts. Now, there are so many signs and symptoms of alcoholism, of alcohol addiction. The first one here is increased tolerance and withdrawal syndrome. Now, there is a point somebody starts taking alcohol. Maybe the person started from a glass of alcohol, let's say, and that glass, just one glass, makes them feel so good and they feel elated. That effect they get from that one glass. A time will come when they keep taking that one glass, one glass, one glass. At a time will come, their body will no longer feel that effect again. It used to feel when they take one glass. So it will make the person to start taking one bottle. Then the person will start taking one bottle, and over again, the body gets adapted to that one bottle. And the next time he takes one bottle, he will not feel that same effect again. Oh no, I need to upgrade. Then he starts taking two bottles. From there to 10 bottles. From there, he can even finish a crate of lager beer. That's how it starts. And when you start feeling that way, maybe you used to take one bottle before and you feel okay. And you feel that kind of pleasure you usually feel when you take alcohol. And then when you take it for a long time, you see that kind of quantity is no longer giving you that effect. Then you increase the bottle. When that time comes, it means you have gained tolerance to alcohol. And tolerance is very bad. You keep increasing. That is how you will continue to increase the quantity you take so that you would get that same effect you used to take when it was a smaller quantity. So that is alcohol tolerance. Now, the withdrawal syndrome or symptoms is that you will stay in a day, maybe a few hours, you have not taken alcohol, your body will start changing. You start feeling nauseated, you start shaking, tremors and all that, as if you are getting sick because you've not taken alcohol for some hours. That is withdrawal symptom, and that is why you see some people who take alcohol for so long, or who are addicted to alcohol. They can't stop it, because once they stop it, they start feeling all these awkward withdrawal syndromes or symptoms that makes them to continue taking it over and over again. Now, another thing is loss of control over drinking. The person will just lose control. You can just go to any place. Maybe he went to this place before, they gave him 2 bottles to drink. He can go to another place, or like reach like 5 places in that day and take from there. No control. Just takes alcohol at will, at any time and at any point in time. You don't have control over what you're taking. That is alcoholism, or alcohol addiction. Then the person start neglecting responsibilities and relationships. There are so many people who are drunkards, who are addicts of alcohol. Before you know, they forget they have a family, they forget they have a relationship, they forget they have responsibility. All they are after is just to go out there and take alcohol and consume, to feel the kind of feeling that they usually have when they take alcohol. It makes them to forget about their responsibility. These are some of the signs and symptoms. Then another thing is continued use despite the negative consequences. The person may know that this alcohol I'm taking is actually damaging something in my body, but he can't help it. He can't stop it again. He continues taking it over and over again. And the person could even start lying about the drinking habit. The person, maybe the person has loved ones around the person. They say, and you have started taking again. Sometimes they could even put the alcohol in a bottle of a non-alcoholic drink, so that people would not know. They start doing this kind of jokes and all that, just to cover up with their drinking. Then there are also physical symptoms like tremors, blackouts, liver damages, and all that could happen when somebody is addicted to alcohol. Now, I'll be listing some of the lifelong, or maybe, let's say, the health consequences that could arise if a person continues in alcoholism, or he becomes addicted to alcohol for a very long time. The first one here is liver disease. It could lead to cirrhosis, fatty liver. Could also lead to hepatitis. Alcohol has been linked to so many health challenges. In fact, alcohol addiction is something that should be avoided at all costs, because your physical health is very important. When you get down with liver cirrhosis, or fatty liver and all that, anything concerning your liver, it is a very bad condition. It's usually life-threatening, and some people don't even come out of it alive. So you need to watch it when you take alcohols. In fact, I personally, I'm a medical professional. Yes, I personally advise that you don't follow what they write on all these alcoholic drinks. Drink responsibly. I'm not a supporter of that. I advise people to stay away from alcohol, because as long as it has an addictive substance in it, it could make you, you could become dependent on it. You start taking it, and you keep damaging your potential and your health. Then another thing is cardiovascular problems. Alcoholic consumption, or alcoholism, can make somebody to have like high blood pressure, even heart diseases, and so on and so forth. Then there is neurological damage also that could be related to alcohol intake. The person may even be having memory loss, dementia. All these things are associated with alcoholism. Then another thing is mental health disorders. There is a point you get addicted to alcohol. You start showing symptoms of mental disorders. Even psychosis could arise. Depression, anxiety. The person will start behaving in a kind of awkward way. Sometimes people will just, why is this person behaving like this? That means the alcohol has started dealing and damaging with his or her brain. Then another thing is increased risk of cancer. Yes, there are so many cancers that are linked to alcohol. In fact, there are so many of them. Then also malnutrition and weight problem. When you keep taking alcohol, every of your focus will be on alcohol. So you will forget about fruits, forget about vegetables, forget about things that will make you to live healthy. So this can make you to come down with malnutrition and all that. Now, what I advise people, especially when you get to the point where you have gained tolerance to alcohol, or maybe you know you have been so addicted to alcohol and you have been having withdrawal syndromes, like anytime you don't take it for like few hours, like 7 or 12 hours a day, and you start feeling somehow like nausea, vomiting and all that, as if you are sick, then until you take that alcohol, that is when you feel better. When you get to that point, you know you have gone far and you are going to a very state of, in fact, terrible condition. When you get to that point, all you need to do is for you to go for rehabilitation. Because when you continue taking alcohol, when you have gained tolerance and so addicted to it, it could damage your liver. You could have cardiac issues. You could even develop mental conditions that are not very good for you. You could even develop neurological disorders and problems. So when you get to that stage, please seek help. You need help. Go to rehabilitation centers. You could be an inpatient or outpatient person receiving therapy from them. And this rehabilitation will help you to detoxify, so that the effects of these withdrawal syndromes and everything could get out of your body. And you will also be taught on coping mechanisms. Like maybe you started taking alcohol because of a bad thing that happened to you, or frustration from life, or trauma, or whatever. They would teach you, give you coping mechanisms that you can adopt, that would help you to come out of your situation. Then this rehabilitation will also help you for your lifestyle. It will help you. They will tell you there how to prevent relapse and give you ongoing support. You could even connect to peers, friends, professionals that would help you to stay in check, so that you don't go back to the state of alcoholism again. Alcohol is very, very bad. The last time I gave I posted a video about ulcer, and alcohol was one of the causes and risk factors of ulcer. So alcohol consumption has been linked to a lot, so much, and so many health conditions that are very bad for you. So today I am admonishing and urging you to stay away from alcohol, and imbibe the habit of living healthily. Exercise correctly, take good food, vegetables, fruits, whole grains, lean proteins, and all this. These are the things you need for you to survive. If you are going through traumatic situations and all that, there are so many other coping mechanisms. There are so many other ways you can calm down apart from taking alcohol. So you need to watch that, so that you don't go down with situations that will make you lose your life. This is what I have for us today. Please share this video. You will be saving a lot, saving so many people from terrible things that can arise from alcoholism. Thank you for staying glued to my channel and for listening to me today. Remain blessed. Till we meet again. Share this video, subscribe and like it. Bye-bye.